Hi, today I'm going to be talking about general medical conditions. I'm going to be answering 4 questions today. The first question is, describe 4 medical conditions that affect the heart. One of them is valve disease. The valves open and close to regulate the flow of blood through the heart. Problems with the valves can increase the workload of your heart and can put a strain on your heart muscle, leading to a range of symptoms like shortness of breath, swollen ankles, and chest pain. Another condition which can affect heart is high blood pressure or hypertension. Although it's not a disease itself, hypertension can lead to an increased risk of developing serious conditions such as coronary heart disease, heart attacks, and strokes. Coronary heart disease is another one, which is caused when the heart's blood vessels, the coronary arteries become narrow or blocked and can't supply enough blood to the heart. And lastly, is angina. Angina is the heart's way of telling you it's not getting enough oxygen when you're doing something strenuous or you're feeling under stress. Many people learn to recognize how much activity will bring on an angina attack. This is called stable angina. The second question, describe medical conditions of the respiratory system. I'm going to be describing 3. One of them is asthma, which is defined as a common chronic respiratory condition that causes difficulty breathing due to the inflammation of the airways. Secondly, pneumonia. It's a common lung disease caused by an infection in the air sacs in the lungs. The infections can be bacterial, viral, or fungal. The third one is bronchitis, which is a condition in which the patients abnormally dilate bronchial tubes. This allows mucus to pool, causing frequently respiratory tract infections, wheezing, and a shortness of breath. Okay, the third question is, explain female athlete triad. Female athlete triad is a medical condition observed in physically active females involving 3 components. The first one is low energy availability with or without disordered eating. The second is menstrual dysfunction, and the third is low bone density. An individual does not need to symptom of all 3 components of the female athlete triad to be affected, but the consequences of these clinical conditions may not be completely reversible. So prevention, early diagnosis, and intervention are critical for this. And lastly, the 4th question is, differentiate infections that are viral from those that are bacterial. Bacteria are relatively complex single-celled creatures, many with rigid wall and a thin rubbery membrane surrounding the fluid inside the cell. Most bacteria are harmless and some actually help. Fewer than 1% of bacterial infections can cause diseases in people. And viral infections, viruses are like tinier. The largest of them are smaller than the smallest bacteria. All they have is a protein coat and a core of genetic material, either RNA or DNA. Unlike bacteria, viruses can survive with a host. They can only reproduce by attaching themselves to a cell. Viruses attack cells in the liver, respiratory system, or blood. The 4 websites I used was www.nhsinform.scot, unitypoint.org, acog.org, and webmd.com. Thank you.